To perform posterior-anterior pressures on the sacrum, or PAs, you're going to take your pisiform and you're going to find the PSIS and come just medial to the PSIS and just superior, because the PSIS is at S2 and we'd like the sacral base. And we're going to put our pressure down on the sacral base on the right and the left, as well as the inferolateral angle, or ILA, on the corner of the apex of the sacrum. So I'm going to come in and I'm going to find the PSISs. I'm going to come just medial and superior. And I'm actually, for assessment purposes, I can use either my thumbs or my PSISs. And I'm going to use my thumbs. And the trick is to not push too hard. What is the least amount of pressure that I can use to make the sacrum go anteriorly on the right? And I compare that to the same spot on the left. And if it's the same amount of pressure and it moves, then that's good. If I have to push harder in order to make it move, then it's stiffer. And if I have to press less hard compared to the right, then the left one is looser than the right. Then I'm going to come down using the heel of my hand and find the base of the sacrum. From the base of the sacrum, the apex of the sacrum. From the apex of the sacrum, I'm going to come laterally and I'm going to find the corner. This is called the inferolateral angle. Again, I can use my thumbs and I gently press down and I say, if I had a scale, I'm probably pushing about 2 pounds, and I start to feel movement. I come across to the same point, the left inferolateral angle, and I press down again. And if it takes more than 2 pounds, it's stiffer. If it takes 2 pounds, it's the same. And if it takes less than 2 pounds, then it's looser. I said I could use my pisiform to perform this technique. I don't find my pisiform quite as sensitive, but I will be using my pisiform for treatment. We might as well go to treatment. That was assessment, PSIS, come in. If I felt that that right side was, let's do the left side since I'm on this side. I'm gonna do the left side because I like to treat from the opposite side, better leverage. I find that sacral base and I want to push it anteriorly. I don't want the ilium to come with it. So I'm going to ask my patient, may I put my hand on the front of your hip?
Yep.
And I grab the ASIS and I put a counter force up towards the ceiling, which is a posterior pressure. And now I'm going to apply an anterior force to the sacral base to increase left nutation. If I needed to increase left counternutation, I would come down to the right ILA. I would apply a force on the apex on the right, which causes the sacrum to come up on that left side. I don't want the PSIS to also come up on the left side, so I'm going to put my hand on the PSIS, gently pressing down on the PSIS as I apply an posterior-anterior pressure on the sacral ILA on the right to induce left counternutation of the sacrum. And that's how you use PA pressures on the sacrum for both assessment of nutation and counternutation of the sacrum, generally using the thumbs, and then using the pisiform as treatment if you find a stiffness.